Welcome to the Checkup. I'm Erica Teichert, Modern Healthcare's Managing Editor of Digital Operations. It's been a challenging year and a half with COVID-19 taking its toll on healthcare workers in particular. They manned the front lines during an unprecedented global pandemic and have felt the physical and mental burden that brought. CEOs from several leading hospitals joined together earlier this year to review how they could create better standards for their staffs at every level of the organization, focusing primarily on physical and mental safety, as well as health justice. Joining me today is Andrea Walsh of HealthPartners. Welcome to the Checkup, Andrea.
Thanks, Erica.
So tell me about the CEO Coalition and how you all came together and decided on these three principles.
Sure. Well, I think, as 10 systems, as we looked at the commitment all of our systems have had to patient safety for some time, we recognized during the pandemic how important patient safety and a healing environment was. And we also recognized that the other side of that coin is that we need to have healthy and high-performing teams. We need to be as focused on the safety and well-being of our team members so that we're able to provide the care that our patients in the community need.
And what would you say is the status of the relationships between the C-suite and the front line?
I think quite good. We've all been aligned, focused on everything we can do to create an environment that allows our teams to bring their best. And we recognize that to provide the best care and the best health support for the people that we serve, we need to have our teams able to bring their best every day. So figuring out new and different ways to support our team members, our care team members, our physicians, our nurses, our pharmacists, our rooming staff, our dietary and housekeeping staff. We're all a team. Healthcare is a team sport, and the health and well-being of the entire team matters so much.
And how has HealthPartners implemented the principles that this coalition has come up with? Has it helped with retaining and attracting staff?
Erica, that's a great question. And I think part of what led us to sign on to the principles was the recognition. We're an organization whose mission is to improve health and well-being. And that mission extends right to the people who live and work in our communities, and especially the people who live and work in our organization that spend so much of their time and their life with us, providing care and coverage to the people that we serve.
And what about rebuilding trust with the staff? How have they been through the whole pandemic?
Yeah, that's a great question. And from our vantage point, great care stems from a healing environment and building trust with the patients that we serve, and building trust across team members. And so as an organization, our commitment to trust building begins with our teams. We've got to have care teams where we've got trust that extends within local departments, local units, local floors of a hospital, all the way out and into our clinics, our pharmacies, our labs. And ultimately, at the end of the day, if trust is broken, we're not able to provide the care that the community needs.
What are some of the ways that you guys are trying to protect your staff, both physically and mentally?
Yeah, great question. And I would say one of the things that we've seen over the course of the last year and a half is the need for enhancements as it relates to health and well-being services. So how do we support health and well-being? And that is emotional and physical health. And then also security. Security has been a big issue. Safety. Patient safety is important. Team member safety is really important. And throughout the pandemic, we saw escalation in the community as people were isolated and frustrated, as mental health challenges continued to increase. Increasingly, our team needed to be able to provide great care and great support to patients who oftentimes don't come to us at their best. People who are sick are scared. People who are sick can get angry. Sometimes the behavior of our patients isn't in alignment with our values as an organization. So we've really tried to put all of our work around patient safety and team member safety through the lens of our values of partnership, of compassion, of integrity, and excellence. And so really being a place that attends to not only health and well-being, but safety, physical and emotional safety of the people who work in our organization.
And how are the staff buying into the commitment statement and the work that you're doing?
Yeah, honestly, it's a journey. Safety of our workplace. We sit in the Twin Cities, Minnesota, and the George Floyd murder last year, and the escalation of the emotion, the anger, the frustration that comes from systemic racism, that translates right into our care environments. And we've got team members who regularly experience what happens when bias shows up, when racism shows up. And so our need to focus on equity and inclusion and helping support our organization be one where every person is welcomed, included, and valued has been top of the list for us, not only last year and this year, but will be for the future. This is a marathon, not a sprint.
Tell me more about the health equity side. What is HealthPartners doing in order to improve that in the Twin Cities?
Yeah, so we've done a couple of things. We began with listening sessions, really calling on the 26,000 colleagues across HealthPartners to join us and express, how are you feeling? Where are we getting it right as an organization? Where are we not? Where do we have opportunities to do better? As an organization, we set some ambitious equity and inclusion goals for 2025, so some 5-year long-term goals, recognizing we can make some short-term progress, but some of these issues require a longer-term commitment. So with those goals in mind, we take a look at our data, we take a look at the way that our culture works, and we've embarked on a couple of different initiatives. We formed an equity, inclusion, and anti-racism cabinet, a group of leaders from across our organization who've come together to convene in a spirit of helping us achieve those ambitious 2025 goals. We also embarked on annual code of conduct training this year in 2021, focused on bias and racism. It's a 2-part module, a code of conduct training. Every year we do code of conduct training that's required across and for all of our colleagues. The focus on bias and racism is one that we want to approach from the vantage point, not of a training check the box, but of really engaging with people to help people understand more about themselves. And we oftentimes talk about it as the fact that we're all on an individual journey. We all need to learn and grow ourselves. We need to support our teams and learn and grow with our teams across our organization and then into the community. So we're also looking at community partnerships. And we've really used the pandemic as an opportunity to learn, how do we need to do things differently? So COVID vaccination would be an example of that, where we were very intentional about looking at different strategies to reach in to the community and to make sure that our patients of color were vaccinated at the same rate as our white patients. And it wasn't any one step we took, it was a combination and really a great opportunity to learn.
And those community relationships, are those primarily for the patients, or are they also for the workers? I know
Yeah, that's a great question, Erica. And I think that the fact of the matter is we all come to our work as people. We all come to our communities and come into the communities that we're part of. And so when we look at our care teams, our workforce, we want you to bring your whole self to work, and we want you to feel comfortable and engaged and empowered to reach into your communities. And so, for instance, with respect to COVID vaccine, we really used the voices of our clinicians, our nurses, our care teams to reach into community with messages to essentially educate the community broadly from a place of trust. Again, beginning with that notion of who do you trust and which messages do you trust? So instead of it being a message from a large organization, the message sounds and feels and is different when it is person to person.
And how has with COVID vaccines and the mandates that are coming with many health systems these days, how is your staff doing with that?
Yeah, I think, again, it stems from a commitment to safety of our patients, and safety of our team members. And vaccine is the number one way that we'll get through this pandemic. So, we're placing a heavy emphasis on making sure that our people get vaccinated as a great way to protect our people and a great way to be able to provide safer, more effective care long term.
And can you tell me a little more about how your staff has reacted after this last year with George Floyd and with racism in healthcare and trying to create more health equity? How has that affected? I'm sure that's affected some of them personally as well.
Absolutely. Yeah, I think there is no question that the last year and a half has been one of great challenge. Every single person who works in our organization has faced a tremendous amount of change in the way we work, change in the way that we need to safeguard ourselves at work, change on the home front, change in virtually every aspect of our lives. And you bring that with you to your work. And we've got this incredible privilege to be able to provide exceptional care to people, but we can only do that if we are able to bring our best healthy selves to work as well. So that's why tending to health and well-being is just so mission critical.
Well, Andrea, thank you so much for your time.
Thank you. Appreciate being with you, Erica.